Namaste. Welcome to Tulip Mediworld Super Speciality Hospital. Today, we are talking about a condition that touches almost every household in India: diabetes and hypertension. Managing diabetes and hypertension is not just about sugar and blood pressure level, it's about balanced lifestyle, regular screening, and most importantly, awareness. Joining us is Dr. Kishore Kumar Talukdar, consultant in the Department of Internal Medicine, Diabetology, and Critical Care at Tulip Mediworld Super Speciality Hospital, Guwahati, Assam. A warm welcome to our show, Dr. Kishore.
Thank you, Supriya, for calling me once again for a very important podcast.
Diabetes and hypertension.
Yes.
As we know that this is really a very serious issue these days, and every house people are facing this, either their family members, parents, or even the younger people are also having the symptoms. So we often hear about this as a silent killers. So why is that?
Yeah, Supriya, very much correct. We consider diabetes and hypertension as a silent killers. That is because both conditions can progress for years
Hmm.
without noticeable symptoms, quietly damaging organs like the heart,
Hmm.
kidneys, and eyes. By the time symptoms appear, complications may already be serious. So that is why awareness and early detections are very important.
Hmm. Okay. So are these conditions really that common?
Yes, absolutely. In India alone, over 77 million people have diabetes and
Hmm.
even more have hypertension. So,
Hmm.
what's alarming is that many are undiagnosed or poorly managed,
Hmm.
increasing the risk of heart attacks, strokes, and kidney failure.
Right. So, how can public awareness make a difference? Suppose, like, what are the early warning signs of diabetes?
Very important question. Awareness empowers people to get screened regularly,
Hmm.
recognize early warning signs, and adopt healthier lifestyles.
Right.
When communities understand the risks and prevention strategies, we can reduce the burden of these diseases dramatically.
Hmm.
And regarding the, what was your second question?
So,
Early warning
warning
signs of diabetes and
signs.
hypertension.
Yeah.
So, regarding diabetes, early warning signs that we can say like increased thirst,
Hmm.
frequent urination, unexplained weight loss, fatigue and
Hmm.
weakness, blurred vision, slow healing of wounds, or frequent infections like
Hmm.
tingling or numbness in hands and feet.
Hmm.
So, these are some common early symptoms of diabetes. And
Right.
for early warning signs of hypertension, often it is silent.
Hmm.
Hypertension is often silent,
Hmm.
but we should watch for persistent headaches, dizziness or blurred vision, shortness of breath, chest pain or palpitations, or even nosebleeds in some cases, fatigue or confusion in severe cases. Both
Hmm.
conditions can be symptomless in early stages. So,
Right.
regular screening is the key for early detection and prevention.
Right. Right. So, like lifestyle modification tips for preventing. Like, is it possible to prevent diabetes
Yes,
and
why not?
hypertension?
We can at least try.
Okay.
So, lifestyle modifications are mainly in the form of diet and exercise.
Okay.
So, stay physically fit, aim
Hmm.
for at least 30 minutes of moderate exercise like brisk walking,
Hmm.
cycling, or swimming uh, at least 5 days a week, because movement helps control weight, blood sugar, and blood pressure also.
Hmm.
Secondly, eat a balanced diet, focus on whole grains, fruits, vegetables, lean proteins, and healthy fats, reduce salt intake, sugar intake, and
Hmm.
avoid processed foods. So we should, there is a term called DASH, that is dietary approach to stop hypertension.
Okay.
So that diet is very important for for people suffering with hypertension or
Hmm.
to avoid hypertension,
Hmm.
or we can go for Mediterranean diet.
Okay.
Nowadays everybody is searching in Google, so you can go and look for Mediterranean diet. It is
Hmm.
very helpful for prevention of diabetes.
Hmm.
Secondly, maintain a healthy weight. Losing even 5 to 7% of body weight can significantly reduce the risk of diabetes and high blood pressure.
Okay.
Then if you're smoking, then quit smoking,
Hmm.
because smoking damages blood vessels, then raises the BP and simultaneously increases the insulin resistance. And if you're alcoholic, limit the alcohol or try to stop it.
Hmm.
So if you ask me, the recommended limits of keeping alcohol if a patient can't stop it. So at least limit it 2 drinks per day for men, and for women 1 drink per day. But better if patient can stop it, then that is the best part. And secondly, manage your stress. That is very important because chronic stress can elevate blood pressure and blood sugar. And you can manage it by practicing meditation, yoga, deep breathing, or hobbies you enjoy.
Right.
And lastly, and most importantly, monitor your health regularly. Check your blood pressure, blood sugar, and cholesterol, even if you feel fine. So remember, small changes done consistently can make a big difference. So
Very true.
prevention is always better than cure.
Very true. Very well said. Very true. Thank you so much. I'm sure that people are getting inspired by this kind of topic. I'm sure because the problem is what the younger generation, we feel that this is not the time to have a health check. Maybe once we are senior, then only we'll go for a health check. What is your opinion in that? Like how frequently or when we should start going for a screening, health screening?
If you're without symptoms, then maybe monthly you can check for your blood sugar and blood pressure. But if you're symptomatic, as we have already discussed in the previous questions, then whenever you're symptomatic, just measure your blood sugar, measure your lipid profile, measure your blood pressure.
Right, right.
And even if you have a strong family history, then you should be very much careful. And you should regularly
right. Any heart conditions
Yes,
or
yes,
diabetic. Okay.
Definitely.
So this is very important and alarming as well. Now, doctor, let us discuss about some myths as well. So as we know that many people are hesitant to start medications for diabetes and hypertension, thinking that this will be a lifelong process, and how would you address that kind of mindset that if I'm scared to start medications for diabetes and hypertension?
Yeah, that is a very valid concern. But here is the truth: medications help control the disease, prevent damage, and improve the quality of life. While it is true, some people may need long term treatment, but that does not mean you are stuck. With healthy lifestyle changes, doses can often be reduced or even stopped in some cases. Think of medicines as tools, not chains. Starting early treatment prevents bigger problems later, like heart attacks, strokes, or kidney failure. It is not about lifelong pills, it is about lifelong health. So many people are hesitant to start insulin therapy and think insulin is the last stage of therapy. But it is not that. They think that insulin has many side effects, etc., etc. But that is also a very common concern. But it is important to clear the myths. So hence, insulin is not a punishment or a last resort. It is powerful natural hormone that helps control blood sugar. So when other treatments are not enough, starting insulin early can protect your organs, prevents complication, and improve quality of life.
Right.
And even modern insulins are safe, effective, and easier to use than ever. Nowadays, there is pen available for insulin administration. So it is very easy and handy. So it is not about failure always. It is about taking control and doing what is best for your long-term health.
Right. Because many people, they're very scared to start with insulin because they think that this is the last stage and I'm like, there is no cure of this. So as we rightly understood that this is sometimes it's a lifestyle disease. A little bit of change, modification in lifestyle will play a major role.
Definitely.
And I as you said that, if I have a family history, so even I'm a young or, a 30 or 40 age group also, I should go for a health check without any symptoms as well.
Sure, definitely.
Right. Thank you so much, doctor. This is really a very interesting topic. And I'm sure that every household, every family member, we have someone in our family who's facing this challenge of hypertension and diabetes. And this is the right time that we must go for a health screening.
Yes.
A simple test, right? What are the tests you suggest that if I'm a diabetic or a pre-diabetic stage or I have a family history?
Go for random blood sugar, go for lipid profile test, regular checking your blood pressure. And if you have a strong family history, as you said, at least do a family history of diabetes or hypertension or heart diseases. At least these 3 tests, at least you should go for. So ultimately, I will say that don't wait for symptoms. Stay a step ahead of diabetes and hypertension with awareness,
Hmm.
action, and health choices.
Very true. Very well said. Thank you, Dr. Kishore, for being here with
My
us.
pleasure always. Thank you.
It is really a very interesting as well as alarming topic, that is hypertension and diabetes management. I'm sure in every family member, we have one of our friend or family member who's suffering due to diabetes and hypertension, or maybe they are prone to this disease. So, on behalf of Tulip Mediworld Hospital, we urge every audience, every person who's watching this show, please consider a health check over disease. It is important to screen on a regular basis and keep a check of your diabetes and hypertension level. Thank you so much for watching this show, and please consider health check. We have customized health check available at Tulip Mediworld Super Speciality Hospital. Thank you once again for watching this show. Namaste.